Hey everybody, Dr. Matt Symons from Palm Beach Health Center. Welcome to Symons Says. You know, a lot of people with pain in their upper back and their shoulder, they go to the chiropractor and they expect their pain to be relieved by having their spines adjusted and manipulated, and a lot of times that works, but there's actually two major causes of that upper back pain. The first is obviously the physical. So a lot of people, who are on computers all day, they carry their heads forward. So one of the things that happens, every inch that you carry your head forward of your shoulders actually doubles the amount of stress and the work that the upper back muscles and joints have to deal with. So that's one of the main causes of upper back pain. So just make sure that when you're on your computer or if you're standing, that your head is staying back over your shoulders. So have someone check out your head shift, because it's the most common postural deformity. But even though that is an easy thing to understand, a less common understanding is that it's not always from just the spinal biomechanics. There are other things that we found over the years, and over the course of 17 years of taking care of people and thousands and thousands of people, if you just take care of the physical stress, you're leaving a big portion on the table. So in finding some other causes actually is the chemical stress. So when someone's having upper back pain and it's also in the shoulder, one of the most common reasons for that is actually having a gallbladder that is getting clogged. And so how do you know that if it's that? So one of the things that you would look at is your overall diet, because the gallbladder has to deal with all of the fats you're putting into your body, and its job is to produce bile to emulsify or to break down those fats. But if you're putting foods into your body that cause the gallbladder or the ducts to actually block up, it can cause an irritation, and that can actually send a referred pain to the upper back and to the right shoulder. And these symptoms often occur due to that unhealthy diet. These could include junk food or a lot of different wrong snacks, too much bad fats and sugars, and actually too much protein can do it too. So to eliminate this type of pain, you should make sure that your carb intake is decently low by either using a keto diet, which is another video, or by doing intermittent fasting. In the mornings, you wouldn't eat until noon. So if that pain can be felt around your scapula area, it could very well be causing problems from the liver as well. So once again, if the problem is diet related, as soon as the diet's changed, the pain usually disappears. Numerous people chronically suffer from these types of pains, but somehow the connection between the pain and their diet and food is oftentimes never made by them or their doctor. Individuals then either simply they kind of learn to live with it, or they go to one specialist after another without achieving any results. And if you know, my definition of a specialist is a doctor who knows more and more about less and less until they know everything about nothing. So it's difficult to imagine that your liver, your gallbladder malfunctioning could cause just like muscle pain, and muscles to be so tight that it actually can pull your spine out of alignment, pinch those nerves, and cause not only pain down the shoulder and the arm, but other organs to malfunction as well. In cases of unresolved pain on your back, especially on your left side, it could be caused by either pancreas or stomach problems. And having too much cooked food or too many nuts, it can put actually a strain on your pancreas, and it's forced to produce more enzymes than it normally would. Pain on the left side could also be caused by referred pain in what's called the phrenic nerve. Pain that shoots down to your left arm could occasionally come referred from your heart. Although it's not common, it can happen. Back pain that resides a little bit lower is not necessarily in your low back, but somewhere in the middle, could be caused from kidney stones. So if you suffer from chronic back pain that doesn't want to go away, it might be an idea to look at your organs instead and look at your diet. It's entirely possible that the pain is not muscular, but actually a referred pain, and that a simple dietary change will remove that pain permanently. Hope you learned a lot, and I hope you have a wonderful, healthy day.